Alrighty, well, I'll just introduce myself again. My name is Trevor Lloyd. I'm a third year medical student at UCLA here with the most incredible, brilliant, phenomenal co-host here. I'll let him introduce himself.
I'm Anthony. I'm also a third year medical student, like our amazing co-host Trevor. Trevor's going to get us started.
Yeah, so welcome everyone. Today we are going to spend a few minutes here, kind of more presentation oriented, where Anthony and I will walk you through, I guess, some general tips and tricks as you approach your personal statement. Some of you guys may have already started, writing up some drafts. Props to you if you have. I probably procrastinated the personal statement way too long because it was intimidating for me to talk about myself. And so maybe you're like me where you haven't even started yet, and that's okay too. Um, and then following probably the next 10, 15 minutes of slides, we'll go into breakout rooms where you'll have an opportunity in a smaller group to ask a med student that you're paired up with more specific questions. But certainly as general questions come up as we're going through these slides, feel free to unmute yourself or put those questions into the chat. And if they're appropriate for the group, we'll answer them as they come. Um, and just a couple disclaimers. Obviously, Anthony and I are just two, very weak mortal humans here. We're med students, and so these things are all just our own kind of opinions here. We're not part of the AdCom at UCLA. Our opinions of you also are not going to be like taken back to anybody else. So don't be embarrassed to ask any questions. And yeah, just take everything we say with a grain of salt. But I think both of us have read a significant number of personal statements and applications at this point and mentored a lot of students. So hopefully we've learned something as we also went through this process ourselves. And just want to acknowledge a few of the other MedMentor members who have contributed into making these slides for all of us to use today. I'll let you start us off here, Anthony.
Yeah, so as Trevor mentioned with the disclaimers, our goal is to, of course, help you to get through this process. And the really one of the big hurdles is to address the personal statement prompt. And the personal statement prompt is essentially, why do you want to go to medical school? It's a 5,300 character limit, which kind of equals to around 760 to 1330 words. And one of the first things that I would recommend as you're starting to craft your personal statement is to put it onto a Word document or a Google Doc and constantly look at your word count and look at your character count, but not to over worry about it to begin with. The character count is there, the words are there, but you want to get your main ideas through first. And that's what we're going to talk about today. So the prompt is going to be again, why do you want to go to medical school? And something to consider is if you're going to apply to the MSTP programs, also the MD PhD programs, there are some other essays that you will have to write, which you can see here that we copied and pasted from the AMC website. So the personal comments essay, which talks about some more personal things related to the MD PhD route. So at the heart, it's why do you want to go to medical school?
Yeah, and I just wanted to add on, I think I fell into this trap of sometimes thinking that the prompt was, why are you qualified for medical school? And when I started subconsciously kind of asking myself that question as I was trying to write down my ideas and craft my essay, I started to get really stressed. And so the stress levels went up. And then I also started to kind of regurgitate my activities and CV. And we'll get into that with these later tips. But just remember the prompt. Like it's not your chance to show why you're qualified to med school. This is kind of, I mean, in the name, it's a personal essay. It's a personal statement to kind of help the interviewer or the AdCom member that's reading about you, like be able to package everything together. So just avoid the prompt of like why you're qualified for med school. That's not what the is. All right. So first tip, it kind of goes right along with what we were just talking about, and that's to know your message. I don't know, maybe some of you guys have watched other YouTube videos with advice from other kind of programs or people, or perhaps you've read some example essays. And I think having a common theme is something that is preached a lot, and I think it can be really helpful. Um, with that said, I was again pretty intimidated when it came to writing a personal statement. And so I spent a lot of time like worried about this perfect theme and how was I going to tie together all my activities. And so um, rather than like starting with this theme that I wanted to portray and kind of get across, I started with three character traits that I thought were important for me in my career as a doctor, as a physician. And so I took those three character traits and then I looked at my list of activities and experiences that I'd kind of compiled and just chose three or four of those experiences that I thought would portray the character traits that I wanted. And so as I did that and started writing, it helped me kind of realize which things fit together, and what kind of overarching theme I wanted to get across. And so it's great if you already kind of know your theme. Maybe it's, maybe it's like something, maybe you're really passionate about global health. Maybe you're really passionate about community health. Maybe you have a ton of teaching and research experience. And so you're going to talk kind of to that and how that will change your perspective or approach to clinical medicine as a physician. Um, but it's also okay if you're not sure what your theme is going to be yet. A lot of us have kind of taken very serendipitous or non-linear paths to medical school, and that's okay too. So don't get too hung up if you don't immediately know what the theme or that kind of the package that you're offering to the schools that you're applying to is. And then just on the slide here, it says to avoid cliches. I agree. I think the most important word on this slide is genuine. I think like being genuine is very undervalued, I guess, or underpreached. I don't know what the right word would be there, but like realistically, a lot of us probably became interested or had that first spark that made us think about medicine because of maybe a common cliche of like maybe we were sick, maybe we had a family member that was sick. I personally like did start off my personal statement with a very personal experience about me and a family member. And so I think it's okay to use cliches. But just the most important part is not that one moment. It's probably the reflection that comes after that. And so it shouldn't be your whole personal statement. Don't put too much stock in one, experience. So yeah, I guess I'll just leave that there. Anthony, do you have anything else to add?
No, summarized it very well.
Oops.
So our second tip is to know your audience. And it's important to realize that readers who are reading your personal statement can be anybody. This includes, faculty who are attending physicians, residents, deans, administrators, even community members who want to contribute to the medical school. So readers can be anyone and have lots of different backgrounds. So you want to make your personal statement appealing to the most number of people as possible. So these readers also likely read many applications a day. And so one thing to consider with your personal statement is you want to try to make your personal statement stand out without being like so without making it so like standoffish, essentially, where essentially you're using really like elaborate story techniques or using elaborate like fiction type of writing. At the end of the day, you're trying to tell your reader a message and you want that message to be relayed to the audience. So one thing that I would often do is as I was writing my personal statement, as I would often make multiple edits, I would have a first draft, I'd read through it, and it sounds great to me. And I think that I'm saying one thing. And as soon as I gave it to my friend or I gave it to a family member, they interpreted what I said in a completely different way. So even though different people have different backgrounds and different expertises, everyone who lays eyes on your personal statement will offer a valuable opinion because at least they will be able to tell you whether your message came across or not. And I think that's one of the most important things is that you want to consider that you're trying to educate your audience, you're trying to have your reader understand your answer to the prompt. And that's why being sometimes really like story-like or really like fiction writing can sometimes go against you is because some people might not understand where you're trying to go with your personal statement. So even though we want to try to be creative, we don't want to go too creative, if that makes sense. You also want your reader to be attentive and curious with your essay, and also that your essay flows. So you don't want to jump from one idea to another idea. At the end of the day, the personal statement is an English essay, and it's like you were writing back in your English, classes and stuff like that. So it still has to have, a main thesis and all that stuff so that there was a reason why that like that flow and that structure works is because it helps the reader to follow along with what you're trying to. So all I mean in summary by knowing your audience is you want to make sure that your essay avoids jargon and is understandable to the most amount of people as possible, while also having a poppy feeling of, wow, I really got to know this person on a deeper level. So anything you want to add, Trevor?
Yeah, I would just add like a warning. So I didn't realize this when I was writing my personal statement, and looking back now that I've had like a little bit of clinical training, I can only imagine it's probably worse for like attendings that are reading some of these. But I think sometimes there's like a lot of hyperbole or exaggeration and even like big assumptions around like clinical experiences as we're doing our storytelling and our personal statements. So just be really careful about making like really strong assumptions or statements about like a clinical scenario. I think it goes back to what we said earlier about being genuine. Certainly, you want to make your essay and experiences interesting to read, but just don't go too far. Don't embellish too much. It will show that you're not really being genuine with what you're writing, and people who are seeing hundreds of patients a week will kind of see through certain like hyperbole, I guess, for lack of a better term. So yeah, just don't try to show off about how much you know about medicine or something like that. This is again why you want to go into medicine, why you want to be a doctor, not to show why you're qualified to be a doctor.
Yeah.
um,
And as Trevor said earlier, if you're being genuine, then it will come. It will come through.
and then yeah, I think that's everything that I had there. So tip number three, this was another one that I was intimidated by. A lot of people told me to like show who you are. Don't just tell us who you are. And I think this ties in with the first tip that I was talking about a lot. So I, because I had so much writer's block that I mentioned earlier, it was really helpful for me to just have those traits that I was trying to show. And then I was able to pull from experiences and say, these experiences are going to show the traits that I want to put across here in my personal statement. And then I naturally like would just take that experience that I wanted to show or exhibit a specific trait, and I would just tell that story. And as like just that process, I guess, naturally led me to show that trait. I'm stumbling over my words a little bit here. But I think if you're trying to take a lot of experiences and cram them into your personal statement and starting with maybe the experiences first, it may be a little bit more likely that you are going to spend more time telling rather than showing. Um, I think another just like one-liner tip here, that's another way to say show, don't tell, is to say focus on individual experiences that you've had rather than like broad general things. So if you are talking about like a specific experience with a family member or a patient or a friend or something like that, you're naturally going to be like telling a good story. Whereas if you're just saying like, uh, like there's the examples here, but as you like if you stay too superficial in generalities, you're going to fall into the whole of telling too much rather than kind of showing. Um, Anthony, do you have anything to add here?
Yeah, just something really short. As Trevor was mentioning earlier, it can be very tempting in your personal statement to kind of regurgitate your resume or to regurgitate your CV. But that's exactly what the telling is essentially. Is like, I was a medical assistant at XYZ. That's a version of telling. Or I, as a medical assistant, I took vitals. That's another way of like a more telling when it's really you're trying to show them like what was it about being a medical assistant in particular? Like what's a story that you can tell about being a medical assistant that made you pursue the path of medicine? So that's kind of the way that I would always frame questions to help me to answer the question of how do I show rather than just list my achievements. That's it. Yeah.
Awesome.
All right. The next tip is kind of adjacent to the showing but not telling, but it's to be specific. So in this example, you can see that through XYZ experience, I learned how to best serve patients. One way that I think about this question about being specific is how can I say this in a way that no other pre-medical student can say what I'm saying? Because a lot of pre-medical students will say very generic things like I learned how to serve patients, I learned how to care for patients, I developed a good patient physician or patient interaction through my good bedside manner. When really what you want to do is you want to be specific about how you did that. And you can do that by talking about some of the experiences that actually made you do, like learn that. And so that's kind of what we mean by being specific is instead of thinking about how to write like very generically and to write like very generic statements and really like standing on a soapbox, as I call it, like statements, where you really want to instead be like, how can I write this so that it's a story that's specific to me, that can individualize it to me, as well as make it so that it's not some other pre-meds experience.
And I think one of the lines that Anthony just kind of used was another scary thing for me. So I'm trying to like help you guys get over the scary thing since I think I approached this with fear. But he said like, oh, we need to write something in a way that like no other pre-med would write it. And for me, I have those voices in my head that are like, Trevor, you're a bad writer, or you're just like everyone else. And so a really specific way to make sure you're unique and different from anyone else is simply to like reflect. So Anthony just talked about it as you specifically share what you learned from an experience, not just like tell the experience, but reflect on that. That's going to be the part that no one else will be able to kind of share the same things that like Trevor learned from this or that Anthony learned from that. So all of you are unique and you're unique because of the things that you've learned in your situations, not just because of the things that you've gone through. So please don't hesitate to share that with the people that will be reading your personal statements. Um, so avoid repetitive I statements. I think as we try to focus on experiences and kind of portray ourselves in our personal statements, it's really easy to kind of go down the list and that character count will start creeping up and you're going to say like, oh, I have all these awesome things that are really important. They're part of who I am. And you fall into the trap of stating like, I did this and I learned this. And it's a little bit monotonous to read. And I think it also, it's too tempting to like try to cram too much into one thing. And so I think this doesn't directly relate, I guess, to the avoid repetitive I statements, but just another tip, like really only try to share 3 or 4 experiences. You might share 5. But if you limit your essay to 6 or 7 paragraphs, that's going to be really helpful to make sure you're putting off like a very concise, specific kind of message to the people reading your personal statement.
Yeah.
And then, yeah, just the reflection part really is going to be what separates like a fine, average personal statement from a great, phenomenal one that stands out. And so, as you spend more and more time reflecting, you're not going to have room for all the I statements. So I would say focus more on like the reflection piece, and you're naturally going to avoid these repetitive I statements.
Totally agree. So our last tip is what we call the hook, line, and sinker. Just again, as I was saying earlier, you want to have some structure in your essay. The tendency is for everyone to like really be very dramatic, and I think that you can sometimes like being the dramatic like at the beginning can sometimes actually be a too much because it becomes very cliche. So what you want to do is really just set an impression. That's kind of what I would say. So set an impression with your first couple of lines in your first paragraph without, as Trevor was saying earlier, without over exaggerating. And then you want basically your focused experiences, as Trevor was talking about, like 3 to 4 focused experiences to support the ultimate fact of why you want to be a doctor. Because remember that ultimately you're trying to answer that question. And then your last paragraph and your last couple sentences can kind of summarize that. What are your main takeaways that you want your reader to come away with? Because that's the last thing your reader is going to read. So the reader is going to be like, okay, I remember that Anthony is this, this, and this. And that's what they're going to remember from your conclusion. So they might not remember anything from your supporting paragraphs or from your hook, but when they read that last paragraph, they kind of are reminded of the things that you talked about. That's the sinker. So basically, you kind of still want to have ultimately a structure to your essay. And sometimes working within that structure, within working on your focused 3 to 4 experiences, it's a good jumping off point for an outline for your personal statement.
Totally agree with that. And I just want to reiterate, like, you do not need to feel pressure or like the need to like reshare these traumatic experiences that you've had. I think sometimes we feel like in order to stand out, we need to relive these traumas that a lot of us have gone through, no matter what those may be. And if those experiences are important and you want to share them, great. But if they're not a super important part or one of the key things that led you to medicine, then you don't have to share them. Again, you can stand out and be unique from kind of the other experiences and reflections of things you learn from those experiences. You don't need to have this crazy, 1 in a million experience or a horrible trauma to hook someone into your essay. So don't feel that pressure to share if you don't want to.
Yeah.
Um,
And then this is kind of what we've already talked about. So, tell a story, keep it focused, don't regurgitate your CV and resume because you've already done that by writing a work in activities. So yeah, so this is kind of just more of what we've already talked about.
so just some final points here. I just want to reiterate what Anthony said, I think at the start of this call or Zoom call here, that it's normal to go through a lot of drafts as well. And it's okay if you haven't started yet, but I would say like first thing that I would hope all of you do, hopefully this weekend, if you haven't yet, is just start writing down something. So maybe you haven't listed all your experiences that you want to kind of draw from yet. Like start coming up with a bank of experiences if you haven't. If you already have that, think of like some character traits that you want to portray. If you have that, then like just start a draft because a lot of us probably wrote I would say like almost an infinite number of drafts because of how many edits and kind of things it went through. So the hardest part is honestly the first step, just starting. So start if you haven't, because there's no I think boon or pro to procrastinating this thing. And yeah, I think that's probably the biggest parting word that I'd want to share with you.
Totally agree.
Alrighty. So I think that's pretty much everything for our slides today. I neglected to put or draw any attention to the QR code. But first of all, if you aren't a part of like the MedMentors listserv, congrats to you for finding out about this without knowing, like being on the email chain. But yeah, so if you're not a member, then please scan the QR code here and then it'll be really easy to kind of find all the different aspects of MedMentors that are extremely helpful throughout the application process. I wish that I had this during undergrad. It would have been so much, I think, easier for me because I came from an undergrad that did not have anything, didn't have a med school, and I didn't have any family in medicine, and so I was lost through a lot of this. And then Anthony, I can't see the chat right now, but he's going to put a link in the chat that will help you guys sign up for what is probably the most important thing moving forward. And that's an opportunity to get your essays reviewed by med students at UCLA. So whether you're a UCLA student or not, you can join OneMov, and there's instructions on there to kind of walk you through the process to be a part of this application essay review kind of team. And you'll be paired up with someone who can give you very specific feedback, look over your essay, offer some pointers, and kind of help you through the process of drafting your personal statement and also secondary essays.
Yeah, as Trevor said, we are the co-coordinators, Trevor and I, for the AEFI Application Essay Feedback Initiative branch of the MedMentors program. And as a part of that, we're a group of medical students that are really want to help with, giving feedback on work and activities, personal statements, secondaries, basically so that you can have your own personal mentor to walk you through and give you feedback based on the things that we talked about today. So with that, yeah, we're officially launching the AEFI program through OneMov. If you have already been doing one-on-one advising through the OneMov program, then you are probably familiar with the interface. But if you haven't, there's a Google Doc that I just put in the chat. And if Trevor goes to the next slide for the recording, you can go to that link to follow the instructions for how to sign up for that feedback initiative. So with that, I'm going to go ahead and stop the recording. Thanks everyone for listening to the recording.